So I used to do like, 20 syringes, 30 syringes in a butt. And then there was a paper that was published that showed that there was really no change in your outcome by using larger volumes. So I now do 10 at a time. We're back.
Next episode today of Unfilter It
With Lindsey and
China.
Here we are, the solo tag team.
Yes.
We're back.
So
what are we talking about today?
We're talking
Linz?
about a bunch of different treatments for the body. So we've always spent our time talking about the face, and everyone's all obsessed with their face. But let's talk about what we have to offer for the body. So let's start with our favorite.
Our favorite non-invasive BBL.
Yes, love it.
What is the difference between a BBL and a non-invasive BBL? Let's start there.
All right, so a surgical BBL, Brazilian butt lift, is when the surgeon does liposuction of any given area and then injects that fat into the butt to make it voluptuous. Now, it's great surgery, love it.
It's
But
actually, it's like two surgeries in one. So you're getting your liposuction and then you're getting fat grafting into the butt. We tend to navigate you towards surgical BBL if you need large volume. So like if you don't have a lot of volume in the butt and you want to create a lot of volume in the butt and you also have places to harvest from, like you could benefit from the liposuction also.
Surgical is your way to go.
Surgical is your way to go. Non-invasive is when we're not using your body's fat and we're using a biostimulator product like Radias or Sculptra to build the tissues up to give you the illusion of a bigger derriere.
Yeah, and not just the illusion. It does get bigger. So the two products, let's talk about it. So we have, you said Radias, Sculptra. They're both biostimulators. Radius is also a filler, so can be used on the face as well. And then what we do, we hyper dilute that to make it more liquid-like, and so that we can do a large volume area. And then you could do the same with Sculptra. Sculptra is a liquid as well. Then they both biostimulate the area. So you can use one, you could use both.
Sometimes I like a combo of the two.
Sometimes you need a combo.
I'll dive in for the science nerds out there is like, what are these products? And I guess first, like what would make a good candidate for a non-surgical BBL is really anyone. But if you're on the thinner side, or maybe you're more muscular and don't have a high percentage of body fat, then there wouldn't be any areas to harvest for fat grafting. So this may be the only option in certain cases. So we'll start with Radias, and like Lindsey said, it's a biostimulator. It's calcium hydroxyapatite, which is CAHA, also known out there if you like on Instagram. CAHA, hashtag CAHA. It is a product that originally started in orthopedics, believe it or not. It's a coral-derived calcium product that was used in orthopedics in ways to like stimulate cartilage and that sort of thing. I'm not exactly sure because ortho's not my background, but I remember
them using it.
And then it came to the aesthetic market primarily with the FDA indication for nasolabial folds and then later hands. And it was a really good treatment for cheeks. I think they have now a cheek indication.
Yes.
It was really good for cheeks because of the biostimulating properties of that product. It helped recreate and bone, your bony prominences. So we would use it along the zygoma and give really nice results. But it also like kind of changed the texture of the skin a bit. So that's kind of how it became more mainstream into our market. Now, probably 10 years ago, I think that there was a lot of fear regarding it because it is a type of filler that when used on the face, let's just say, you didn't really have a way of reversal if you ran into problems with vascularity. And we've since discovered that there are ways to mitigate that risk. So it's been used fairly safely in recent years. So back to the butt, we take this product, the CAHA, calcium hydroxyapatite, we water it down with some saline, and in large volumes we'll inject, or larger volumes than we would the face or other areas, we inject it into your buttocks. Now, there's a lot of information out there and videos about people doing this, and I've since changed my practice recently, just because people that know us know that we follow the science and we are very paper-backed. So if there's a paper that comes out that proves a technique, then we are apt to try it, and we're all for it. So I used to do 20 syringes, 30 syringes in a butt. And then there was a paper that was published that showed that there was really no change in your outcome by using larger volumes. So I now do 10 at a time.
Yep.
And then if you want to keep building, we'll do another 10, we'll do another 10.
Yep, every 6 weeks or so.
Every 6 weeks or so.
And then I tell my patients that, okay, so we're going to build to the booty you want. So I'm going to see you every 6 weeks till you have the booty that you desire. Or we could even do it for hip dips, for little tiny areas of cellulite. But for, the global volume building, we see you every 6 weeks till you're happy with your booty. Then it's probably, then you're going to want to do maintenance like every other year. It really depends on you and how you break down the product, how well you rebuild collagen. Like there's so many things. So you could have one patient that will have a couple treatments and they're good for 5 years. They're happy with their butt.
And what I like about this approach as to others that I've used in the past is it's very customizable. So I have the ability to use, 10 syringes and I might put it in a particular pattern one time, and then your next treatment, I might do a completely different pattern just to kind of hit your goals of what you want it to look like. So that's Radiesse in a nutshell. And then there's Sculpt, which is also a biostimulator. It's polylactic acid, which is also a stimulator of collagen. So both of these products cause an inflammatory response that will create a collagen baby because these fibroblasts attach to these molecules and make collagen. So Sculpt, very similarly used in the buttocks for non-surgical BBL. I tend to use Sculpt more in patients for non-surgical BBL that already have a bit of volume and that we're looking for more skin tightening and maybe a little bit of lifting.
Yeah. So just like we use it in the face for laxity. Sculpture's great in the face for that, and in the booty as well. Also in the thighs, you know, and you could use both of these products there as well for crepey thighs or above the knees. A lot of people complain about that.
Yeah.
too.
So on the buttocks, there's also kind of a spin-off to the non-surgical BBL. There's also treatments that we could do for cellulite. So I'm going to be a little historical. There was a product that I used to train people on called Quo, which is currently no longer on the market. And this was a really good medication that was used to do a non-surgical subcision of the cellulite dimples, which, in years past, we subcise these things all the time. And so what subcision is actually cutting or going through these fibrous bands that tether the skin down like a tufted pillow.
Yeah, that's what makes cellulite.
But there were a couple downfalls to using that type of problem. If you were not versed in skin laxity and you were treating skin laxity instead of true cellulite, you could actually make the appearance of it worse, which is sometimes a problem with liposuction when we're talking about the tops of the thighs or even lateral thighs sometimes. So what's beautiful about these products, like your Radiesse and your Sculpt, is you can utilize them in a way where we're maybe even needle subcision of the cellulite dimples.
Absolutely.
And then placing the product underneath it or in between it to cause collagen to build there and pop them out. And we work, we co-live in this beautiful community of surgery and non-surgery.
Yes.
Where there's some surgical treatments that they're still doing, right?
Yep. So there's just so many things that they could do now, and they're trying, what is that new one? What is it called?
Avalai.
So there's something else coming out, but I think cellulite's difficult.
Cellulite's tough.
And
so
it's really subsizing it. So before, if I'm doing Radiesse or Sculpt for some cellulite dimples on the butt, thighs, wherever it is really, I'll usually use a cannula and I'll subsize underneath there. And you could kind of see it release a little bit.
Yeah.
And then in that zone, I'll kind of, kind of fan out the product in there.
down.
And then whatever, 6 weeks, you come in, see me again if you need it again. And sometimes they're stubborn.
Yeah.
Sometimes the treatments we do aren't one and done.
And sometimes we'll refer you to the surgical aspect of our practice and be like, you know what, you need a surgical release of these tissues that might be beneficial. So that's basically your non-surgical BBL in a nutshell.
Yeah,
It
not
is-
much aftercare, so let's talk
Right.
about that. It's a
Aftercare
little
is-
sore.
Maybe a little sore.
There's no homework.
Bruising.
Yeah, definitely bruising.
There's no real homework except if I use Sculptra, I do like you to massage it 5 times a day for the first 5 days, which, can be a little bit sore in those first 5 days when you're massaging, but it really
Yes.
just does help prevent any lumps and bumps from forming.
Yeah, you want to really massage those particles around.
But
with Sculptra.
unlike your surgical component, like you can totally sit on your
Sit.
butt.
Yep.
You can go to work. You do your normal
your life.
activities, right? You're not recovering from liposuction where you have like donor sites that you have to worry about, and garments
the
and
whole thing.
compression and massage and whatever. What else do we need to talk about? The BBL? Anything else?
Get it.
Yeah, get it.
Come and get it.
If you're
Yeah.
curious and you're not sure if you're a candidate for either a non-surgical or surgical BBL, that's not your job. That's our job.
We will tell you.
So you come to us for a consultation. We will look at you and tell you, yep, this is the right thing to go. Ultimately, we want you to have the result that you want. We're putting our name on it, so we want quality, obviously, and always. So now moving on to the thighs. Thighs have been tough. I will tell you, we're in this industry a long time.
Thighs are difficult.
Thighs have been probably the hardest thing to treat as far as appearance goes because the skin on the thighs is tricky.
It can be thin.
It can be thin, it can be
It can
thick.
be cellulite. It can be lax. It's like it goes, and it could be all of those things in the same thigh.
Right, and unfortunately, the surgical options for the thigh are very limited. And there's liposuction, and at its most extreme, there's the thigh lift, which
That's if you like a lot of extra skin.
if you have extra skin, and even so, like it's a very difficult procedure to do as a surgeon, I would imagine. Because the scars are hard. The scars are hard to hide.
Even too, like a lot of our patients with thigh lift, it's just a difficult healing process. Not to talk anybody out of it.
Yeah,
If you have a lot of extra skin, 1,000%, just go for the thigh lift. Anything that I personally have that I could offer are not going to give you the same results if you have massive weight loss.
That is true. Some people just need it.
But it's really the incision is up the middle of your leg, and then most of the time in your groin
the
too, and you
bikini
get the
line.
whole thing. So that bikini line, it gets sweaty, and that
Yeah,
thing's like
it's
hard
just,
to heal
and
sometimes.
this is something that,
Yeah.
the surgeons are very upfront about. Like
Yeah.
any plastic surgeon that's reputable is going to talk to you about scars. No matter what, even if your scars heal really well and are undetectable, there are still scarring that happens.
Yes.
And, that is a conversation that you have with your surgeon to discuss the best placement of the scars for you. That's going to give you the optimal amount of healing. So with that being said, some of the treatments that we offer that can even go in tandem with your surgery or not is the treatment of the thigh skin in particular. So there are some treatments that you and I both do that we've been
Yes.
successful with.
So, like we've talked about radius.
talked about
I've done
radius.
hyperdilate radius in the thighs. There's some great studies
There
about
are
that as
some
well.
really good
So
studies.
we love our good studies, and we really love to, be backed by some scientific information. So love that. So that helps with laxity. That can help with cellulite. What else? What else do you like?
Also, I think that if you look at a non-invasive treatment for the thigh, you can expect that you can get anywhere from 25 to 30% improvement with each non-invasive treatment. So I like to do combination treatment. So like Lindsay said, if you're a Radiesse candidate or Sculptra candidate for the thighs, I usually like to pair it with something that is a device. So whether it's radio frequency microneedling or ultrasound tightening, I think both have really good data backing that. So one of the recent things that I've been loving is the studies that are done with soft wave.
SoftWave. Yep, so SoftWave is a ultrasound-based technology device that heats the skin to tighten it, build collagen. That's like the easiest way to explain it. It's good for every patient, any time of year, every skin tone, just anybody can get it. And when I first thought about getting the SoftWave device, I was like, yeah, okay, yeah, right.
Yeah.
Nothing's ever good for everybody.
Nothing's gonna work.
But it actually is. And the more years that it's out, they're getting approvals for more parts of the body. So now it's like face, neck, stomach, thighs, arms, which I'm gonna try soon. And again, it's really, you come get your treatment, you don't have, there's no downtime. That's
So I
what's great
think
about
that was the one thing that was hard for me to wrap my head around too. Because I mean, you know,
where we come from.
Where
it's
we
like,
come from, it's like if you don't look like you were hit by a Mack truck after your treatment, it's just not going to work.
working.
It's
There's
just
no
not.
way. Yeah.
But like, you know, the non-invasive device world has really exploded and gotten better in the
Yep.
last couple years even. So going back to ultrasound technology of years past, we had Ulthera, which was a great treatment if you knew how to read an ultrasound and you knew exactly what plane you were in. It gave you
Exactly.
a lot of options. It's still around today.
I think it had a lot of user error though.
It had a lot of
and that could
user
really affect
error for sure because
outcomes.
you know the ultrasound I mean I can go on and on, but the ultrasound image maybe wasn't that clear, and so you really weren't sure what plane you were in and what you were treating. And the downside for the thighs in particular is if you were using the Ultherapy device, one, it was very painful. Two, it took a really long time to treat a large area. And three, you know, if you went beyond the dermis of the skin and you were treating like deeper than the dermis and you ended up getting into the fat layer, you were then dissolving some of the fat, which would make your laxity look worse. So in some instances, I think that was the problem. So new generation ultrasound skin tightening, we have SoftWave, which is a radial instead of a focused ultrasound.
Yeah, it's parallel beam.
It's parallel beam, so it goes out instead of down. So it's designed to really only treat the layers of the dermis only and not get involved in the fat layer at all. And it does kind of yield. At first, I would bring patients back too soon, I think, because I would bring them
you
back.
gotta wait the 3 months.
Yeah,
Should
I
be
would
like,
bring
"See
them
you in a
back like,
month."
see you in 2 weeks, and then I'd be like, nothing happened, and then I'd say, see you in another 2 weeks, and then nothing
like,
happened. Although, I have to say, inadvertently, I saw a patient at a month, and I didn't think that.
That's what I was gonna say.
Yeah, and I was like, okay.
No, something's happening.
Something was happening.
There was a couple patients, they came back before the 3 month mark. Honestly, I think it was around like a month too.
Yeah.
And she's like, my neck's getting tighter. And I was
Which
like,
kind of makes sense, because that's kind of when your
it starts
collagen
around
starts.
like, yeah, it's like that 6 week, somewhere in there, 4 to 6 weeks. And I'm like, come on, Susan,
Yeah,
no way.
come on,
And-
Susan.
And then I was like, let's take pictures. And I was like, oh man,
You
it
were
does,
surprised.
it is. Yeah, I was
Yeah.
always like, nah, no
Pleasantly
way.
surprised is
they know,
always
they
good.
know their faces. They know they're sitting there looking at their face constantly, which I tell everyone, back away from the mirror.
Yeah, cover
But,
the mirrors while you're in treatment.
Yeah, just forget it.
So what I think is why I think combining your treatments, especially for the thigh, is like if statistically you're getting 25% improvement from non-invasive, right? If you combine them, you're increasing your percentage.
Yeah.
So you can get like a 50, maybe 60% improvement, which is great for not having surgery, because we know like if surgical correction is close to 100% correcting.
Yeah, you could get 50.
That's
non-invasive
pretty good.
And no anesthesia, like
No
barely
downtime,
any recovery time.
no scars.
I mean, that's great. And yeah, I love it. I also think that it's nice to hit the same problem from a couple different angles.
for sure.
So in many things in life, not
Everything
just that,
in life.
but I think that can really expedite the process as well.
Definitely. So those are good treatments married together for the thigh. And then in some instances, if you're a good candidate and you have good tissue quality, I would also recommend some thread lifting, which either using barbed threads or smooth threads. Like sometimes if you have like a little excess skin that's like kind of hanging out at the top of the knee, there are barbed threads that we could put in that's going to give you like a little bit of lifting temporarily, so that, and then build collagen at the same time.
Yeah,
We
China's
could
the thread queen.
Here I am. We
Yeah.
could also use smooth threads, which are just basically injectable sutures that go into the skin and create collagen. So the goal of all these skin laxity treatments are creating collagen, and the more ways that we can do that, the better your result will be.
Absolutely, and that's what the aging process is. We're aging, we're losing collagen, you know, certain spots we're losing bone, and that's just the way to treat these things.
The other thing I wanted to mention for thighs that I just thought about now is the body peels. Why don't we talk about the chemical peels for body for a minute?
Yeah, so VI peel can be anywhere on the body. Does help with, I'd say, like a little bit of tightening. It's really just like, what's the best way to explain it? Maybe like a sandpaper for your skin. You know, you want to just resurface it a little bit, get a little bit of tightening.
The same way we use a chemical peel on the face can be used on the body. And that's sometimes helpful for people that maybe have some pigmented issues of the thighs that they don't like.
Yeah, and even like groin, armpits. A lot of people come in, they hate their armpit color, which, you know, I don't technically think about all the time.
Do I have armpit color?
No, your armpits are good. I'll let you know.
No. Sometimes I'm like, do I have
I had someone ask me not that long ago, like, what can we do for my groin discoloration?
Yeah.
And it's like, women, like, things rub, you know, like, so people don't think about that, but peels are really good for those areas and to get that pigment back to normal. Yeah.
How about the tummy, the tummies,
So
the
tummy,
scrotal tummies?
Scrotal tummies postpartum. So a couple things. It's literally everything that we're talking about can really go in any zone of your body. So I think depending on how much extra skin there is there, we can do, you know, Sculptra, the hyperdilute radiesse. You know, some people need the threads in there for the pulling. And then, you know, soft wave is definitely, you know, making its way into a spot in that arena as well. The before and afters are looking really good.
And I really like that, you know, soft wave has really no downtime at all. Right? There's nothing.
Nothing.
I don't even give my patients
There's
instruction
like no side
pamphlets.
effects.
I'm
There's
just
no
like,
anything.
live your life, have a good day.
Enjoy.
Enjoy it. Just don't go to hot yoga tonight, you know? But honestly, it is one of those treatments that, you know, has really come to market. Now, I wouldn't be me if I didn't talk about the safety of utilizing these devices. And here at It Aesthetics, we are in New Jersey, which has very strict restrictive laws
that not everyone's aware of.
Everyone is aware of, and so it kind of makes sense. Like in my day, I used to do all the L-therapy treatments because I was reading an ultrasound and I was like, you know, that was what my training was. So, but in New Jersey, if you come to our practice, it's Lindsey and I who are doing your treatment of soft wave because that is what the law dictates and that is what our license allows. So it's us doing it, nobody else. You guys are stuck with us for that type of treatment along with your injectable. So, I mean, I think that's important to talk about because there are a lot of, I'm a trainer nationally, you're a national trainer for our company, and there is some stuff out there
that's very cowboyish.
Very scary. And like, I can't even, I even remember coming back asking you these questions, like, how are people doing this if it's not even legal? But they are. I had a patient the other day, kind of off topic, that was like, I used to get my PRP in somebody's house. What? What are you talking about?
Like,
that's a blood product. Like crazy.
It's like my my hospital heart is like.
Yeah, my hospital heart is definitely.
What are you doing?
VFib.
Don't do anything in someone's house ever, except go to dinner. Don't do anything.
You know, like when I said that to the patient, I was like, that is not legal.
No.
He was like, well,
But then you find out
legit.
the provider that's doing it isn't even licensed to even do these things.
So scary. I digress though, but yeah.
We could have a whole 16 episodes about this.
So belly is the same thing. Kind of all of these areas are enveloped with the similar combination treatments.
Yeah.
Belly is also really good for Morpheus or radio frequency microneedling.
Absolutely.
That has a little bit more of a physical, not a physical, I guess a superficial downtime where you're red and might have grid marks for a couple weeks.
But nothing major.
Nothing major. You can still live your life and do your normal activities. If you're of the darker skin tone or maybe Mediterranean background like me and are prone to a little bit of pigmentation post-inflammatory, that is a concern sometimes with those treatments, but also able to be managed by...
And we can pre-treat with lightening creams and things like that.
Managed by a provider that knows what they're doing. These are normal things that we navigate through. But all of these treatments in combination, like the butt, the thighs, the abdomen, and the arms, are really good. Let's talk about
Yeah.
arms for a minute, because I don't think everybody knows about this treatment.
Not everybody knows about arms with soft wave.
Yeah.
So it's new, it's a new approval for skin tightening of your arms. Like right here, everyone hates it. It's all
That's
crepies,
like
like right in front of your armpit for people
Yeah,
that
for those
they're
that are
not watching
listening.
the video. Yeah, the little arms there, you know, that area. I mean, another thing people really like here, like Kybella
Yeah,
too.
oh, the bra fat.
Yeah, and like that little pouch that comes right after your armpit before your breast, kind of like that little front little bra pooch. People hate that as well, so Kybella is good there. But back to soft wave, yes, if you want a little bit tighter arms, yes. Is it going to, you know, tighten your arms like you had some surgery? No.
Right.
But it will give you some more skin tightening. It's really, think of it as skin tightening, not as volume decreasing. We're not killing fat with soft wave.
Right.
You know?
Especially in the era of like people now, I think, are more health conscious and trying to get on top of the epidemic of obesity. So there's
Yeah.
all of these aids now. There's, you know, bariatric surgery. There's a GLP-1 agonist. There's all these
Yeah.
things that cause a rapid decline in weight that can cause skin laxity
Absolutely.
in people that are not 20 and even in their 20s. So
Yeah,
these
so
are
if you're on some of those meds, I mean,
Yeah.
come see us. We'll
These-
treat you through your process of losing weight so that you stay tight. It's
yeah,
good.
and you know, you hear about all these things like Ozempic butt, Ozempic face.
face and all
I
these
think
things.
it goes way more than that. I think it's more like Ozempic
Body.
body,
Yeah.
because it's like it affects your face.
I mean, we've seen people Ozempic booty. I mean,
Yeah,
100%.
I mean this is like nothing new. I think it's a new term that they put out.
Yeah,
but
it's just
like,
weight loss. It's just weight
weight
loss.
loss. Like
it's-
when
yeah.
bariatric surgery started and
Same
everyone
thing.
was getting the same thing would occur. So there are options available, and some of these now biostimulators, they have both been on the market for a long time, so they're proven safe. They have their FDA approvals, so it is something that we know scientifically works.
Exactly.
And a lot of the treatments that we do are off-label, meaning that even though the product is FDA approved, it may not be FDA approved for those areas. That is something that your provider should be telling you also, like, hey, this is an FDA approved medication, but not necessarily for this area. We do it off-label. Here's my experience, and here's
Right.
my complication rates and whatnot. It should be very low, by the way. There's not a whole lot of risk involved.
Yeah, no. So we also wanted to talk a little bit about like acne, melasma,
Oh,
rosacea,
yes.
all those things that, you know, we have a ton of population, they're young. They don't need all these things.
Right.
But they're hating on their skin. They have acne, they have
So
melasma, like
segue-
postpartum,
yeah.
all these things.
Melasma, for a second, and for those of you who don't know, is a type of pigmentation that can happen really anywhere on the body, most commonly in the face, particularly the forehead, the upper lip, the cheek, sometimes the chin and jawline as well. It is not your typical like sun damage that comes out like freckles. It's more of like a uniform darkening of those areas, most commonly in skin types that are, you know, 3, 4, 5. But I have seen it in lighter Fitzpatrick's as well. This has been very difficult to treat because it's heat and hormone regulated. So
Right.
lasers become an issue because it generates heat. Radiofrequency treatments can be an issue because it can make it worse with heat. And you know, years ago we used to treat this with just like straight microneedling and like pray to the surgery gods that it
Like,
did something. And in some cases it does. In some severe cases you may need an oral medication to treat that. And now I know in the derm space there's like a lot of stuff coming out about oral medication for melasma, but
I do like a couple things for it. So the difficult thing with melasma is just we're treating your melasma just as if you would say take your blood pressure pill. Like there's nothing that's gonna 100% get rid of your melasma. Is there things that you could do to keep it at bay? Yes, 100%. There's so
and then
many
it's
things.
like a work in progress.
Yeah, and there are times, you know, I'll treat people like I would do like IPL or something like that. I like that for melasma. And then there's times where you could have 6 month span and it's cool, it's kosher, they're okay with it. And then say, who knows, they get pregnant, you know, and then it's generally pretty prominent in patients that have it after pregnancy, hormone changes, things like that. That's very common. Peels are great for it. The problem with peels sometimes is sometimes the melasma is deeper, so you do need something deeper. So we do
Or a series of peels
yeah,
you need.
series of peels. Fraxel laser can be good for melasma too.
So
It's a combo.
The standard treatment for melasma I would start probably with is either a peel or the pico laser, because pico's not going to use, it's photoacoustic and not photothermic, because the heat is really what we're trying to diminish. You can see like melasma gets worse if you like hot yoga or you're a runner, because that heat is stimulating the hormone to create the pigment.
Even just in the summer.
Or
you know,
even in
just-
the summer.
yeah.
Hashtag me too.
Yeah.
But yeah, so the one thing I wanted to segue with the melasma is that there is, it's not an FDA published study for Sculptra, but they did do a gene expression analysis study that showed that there is a gene that is expressed when you do the Sculptra treatment. They took biopsies of nasolabial fold anyway. There is a gene that is expressed that helps suppress the pigment that causes melasma. So it is like something that I think is in the works. But yeah, that is also a treatment that we could do to help. Yep.
Yeah,
that
Sculptra.
Yeah, Sculptra
Sculptra
and
peels.
chemical peels.
That could be really easy.
That could be real easy. Acne is like a whole, I think, topic in itself. And I think acne in moderate to severe forms belong solely in the dermatological space
Agreed.
because there are oral medications that suppress your immune system and like speed up your cell turnover that are important for those types of treatments. But
That's like bad cystic acne.
yeah, but I think in our space in plastic surgery, and we do get referred a lot from derms for acne and for scarring in particular.
Yep.
A lot of these treatments in combination, and for acne is like a whole treatment plan, especially if you're female, especially if it's like age-related hormonal changes for cystic acne. There's medication that we'll put you on orally. There is a regimen that we will put you on topically.
There's a whole thing.
There is chemical peels involved. There is laser treatments involved. There is resurfacing treatments involved and chemical peels. So like probably acne is the hardest. But we have had lots of success with.
And generally when I see acne patients, it's mostly for scarring.
Yeah.
So if someone comes in there asking me, you know, they hate their skin or whatever, I tend to send them to our estheticians. They will, you know, go for it and get them on a really good regime of skincare, and they're really great at it, and the red light and everything. And then we're gonna do lasers or microneedling, things like that for
Here's
scars.
what I love about radiofrequency microneedling for acne and acne scarring is that in the right hands, if you follow the right protocols, you can treat scarring and active acne at the same time, which is something that's really been hard to kind of do. And the downtime is quite minimal. But another nice treatment option for acne and acne scarring is PRF.
Yeah.
So that's when we take your blood, we spin it down, we take the platelets and the healing properties out of it, and then we create that into a gel. It's quite the science experiment for us when we're in office.
Mixing
but
and heating.
The treatment is similar to getting a injectable filler treatment, and it's utilizing your own stem cells, your own biostimulation, your own growth factors to create a healing cascade.
Yeah, and I think it's great. And then also about carbon facial. You love that too.
Oh,
for
carbon
acne.
facial, yeah.
Yeah, carbon facial is really good.
So carbon facial uses our Pico laser. We have the Candela Pico way.
Yep.
And we apply a carbon lotion to your face, which has a cooling sensation. And all that does really, because carbon is like such a good oil absorber, it soaks into your pores and it is attracted to the sebum, or the oil that like lives within our pores. And so it directs the laser to just go there because it's such a dark pigment that it won't go beyond where the carbon lays. And so, you know, in other parts of the country, they call this the Hollywood facial because you could go on your lunch hour. It gives you like a really nice glow for the weekend.
Out. It's like eating all that bacteria.
But it does. It like pulls all that bacteria out.
Yeah.
And then because of the way that the laser is designed, the photoacoustic portion of the program will shrink the pores. So I do this a lot. It's great for active acne. It's good for acne scars. It's good for pigmentation. So your darker Fitzpatricks that have some post-inflammatory staining, it's great for that. Totally forgot about that. Good recommendation.
I like the carbon facial.
I love the carbon facial.
Carbon facial is good.
And what other thing did you say? Melasma, acne, and what?
Rosacea.
Oh, rosacea.
Rosacea is another thing. It's kind of like melasma, very hard. I don't want to say very hard to treat, but it's like you can't 100% always get rid of it. You got to get on a regime for yourself, which includes skincare, product, and then you can do some laser.
For all three of these medical conditions, we are hand-holding together, Kumbaya style, with the dermatologist.
Make you be your best. And
like I have some derms in the derm field on speed dial. For those of you that know my friend Allie and Spinelli, both of them are derm NPs. Like literally, I know we have to have them on.
Day.
We're gonna have derm day. Yeah. They are like my go-to, and Lindsey and I are very good about we know what we know, but we also know what we don't know, and we're okay with that. Yeah. So we're happy. There are other people that are experts in what they do, and what's nice is like I don't have to compile my brain with all that information because they have it in there. Yeah. So I'm just gonna send them.
It's like Who Wants to Be a Millionaire? Phone a friend.
Yeah, it's like a really good collaboration, and so when things aren't working that we're trying, or if I just look at you and you have severe rosacea, I'm just going to send you to the people that can treat it a little bit better than I can. But, I do think that rosacea is one of those things that can mimic a lot of other things too. So, I mean, once your rosacea is simmered down and at a stable environment, you and I can do things like hypercation of the capillaries that come to the surface.
Like those little tiny red blood vessels, everyone hates them.
We have topical product lines that are designed to help keep that down. Like you said before, some chemical peels also can help keep that at bay.
To be honest, in the past, I've used laser for rosacea, and it's okay. Yeah. But I honestly think the peels and topical are better, to be honest. I like the hypercation for the little guys, but it's like the overall little capillary flushing. I really like products more.
I feel like chemical peel too, I think anyone you talk to will say the same. It's like the reset button for problematic skin. Yeah. Especially if you choose the chemical peel appropriately. It's like, oh crap, the skin's going crazy. Reset.
Yeah.
Like it's
and
then
you boom, start over, see how they did. So and then they start with some products, and it really helps to keep it at bay with rosacea. Yeah, I like that better than lasers, to be honest, for that.
So, I mean, I think overall the theme of this story has been in our non-invasive space when we're talking about any treatment off the face or even on the face, combination is really the way to go. So, I mean, I think our patients are comfortable with our recommendations usually because they know us. But like if you're walking into someone that's not us and they're like throwing a bunch of different treatment options at you, I think that maybe in the non-invasive space should be expected. Like it shouldn't be a one-trick pony.
It never is.
It never is.
Even with filler, with anything, it's not. We should be doing filler, because we bake the cake with filler and then you need your icing. So you need to do good skincare.
Right.
So it's like a really combo of literally everything to be your best. Yeah.
Well, all right. I think that's
Let's be our best.
Let's be our best. Let's end on that note. We are going to be our best here
on Unfilter It
with Lindsey and China.
See you next time.
Bye.